It's the injury the struggling Chiefs could least afford. Jamal Charles out for the season after suffering a torn ACL versus the Bears. Today, head coach Andy Reid talked about the star running back.
Coming back and getting himself back, that's where his energy will be directed now, getting through the surgery and getting himself back to where he can play. And that's where it should be.
It's not every time you see that, those types of falls and knowing you don't have an injury.
Dr. Daniel Farrell is an orthopedic surgeon at Overland Park Regional Medical Center.
That structure right there is this one that's torn. That's the torn ACL.
As for ACL surgery, he says it's pretty straightforward. First, holes are drilled to create a footprint for the joint.
And then we pull this tendon bone graft up into this tunnel, across here, which recreates the ACL, and then the other end of the graft, another bony side of the graft, goes into the socket of the femur.
Working in Charles's favor, he's an elite athlete.
His tissues are extremely strong, and the bones and tendons to be able to reconstruct with his own tissues are, they're optimal.
Charles's injury isn't that uncommon. In the last 4 years, there have been about 50 ACLs in the NFL, and barring any setbacks, the prognosis is for him to be ready to go next season in Arrowhead. Live at Arrowhead, Jonathan Carter, KCTV5.